for the Regional SRHR Fund. Thank you.
Good morning, everyone. Good morning.
Good morning.
My name is Nogupiwa Moyo. I'm with Youth Advocates, Head of Programs. Thank you so much for joining us. We hope to interact and learn more as we proceed through today and tomorrow. Thank you.
Good morning, colleagues. Good morning. My name is Maxwell. I'm the Programs Coordinator with Restless Development. We welcome you, Mwauya. Thank you.
Thank you so much. Am I leaving out anyone? Good. So briefly, I'm requesting that you turn to the leaflet in front of you. We want to run through the day. Then after that, we're going to invite opening remarks. Hello, are we there? So you'll notice that we are here for 2 days, today and tomorrow. And oh, so that those who haven't introduced themselves. Okay. Sorry for that. You can start with you.
Good morning, everyone. Morning, everyone. My name is Nyasham Davanu. I'm the Advocacy and Gender Advisor for Population Safe Zimbabwe, regionally known as Maristops International. Thank you.
Good morning, everyone. My name is Diana Milos. My father is from Malawi, so because of that, I am Malawian, but I was born in Zimbabwe. So because of that, I am Zimbabwean. And then I have a passion for Africa, which makes me African. Nonetheless, I'm with the advocacy core team, and we're an organization that works around health financing and health policy. I think my expectation from today is just to get a sense of what everyone else is doing, learn from that, and then also borrow, more like stealing from what people will share, and then hopefully use some of that for some of our work that we are currently doing in Zimbabwe.
Good morning, everyone. My name is Gertrude Mube. I work for Ministry of Health and Childcare. I'm the National HIV in childcare. My expectation is just to see how we are going to integrate, collaborate on HIV and SRH in a space now where our resources are very much dwindling. So I think we have to work on something as the regional people who are planning for our sexual reproductive health rights. Thank you.
Thank you so much.
Good morning, everyone. My name is Jeremiah Manyika. I'm with UNA Zimbabwe Country Office. I'm an advocate for SRHR, human rights, and gender equality. Thank you.
Morning, everyone.
Morning.
My name is Leslie Garura. I'm the Director for Restless Development, an agency that invests in the agency of young people to come up with solutions to the challenges that they face. So I'm here to see that in action. Thank you.
Good morning, everyone. My name is Miguel Steven Sichone. I'm with HIVOS under their Youth Advisory Panel for the SRH Fund. My key takeaway from this engagement is how are we going to amplify the voices of young people in the context of dwindling funding within the SRH space?
Thank you so much. We have one delegate who just came in. It will also be good to hear from her. It's you, yes.
Thank you very much. Good morning to all of us. Sorry, she was delayed, but she came. Her name is Perseverance Joe. They call her Gonyet. She loads in, she delivers. I'm a member of parliament, Zimbabwe. I represent the constituents of women, meaning I come from the proportional representation, the women's quota. I sit in the health committee. Here is under HIVOS, I'm the regional champion for here in Zimbabwe. I have a passion for children, women, and you as well. I thank you.
Let's appreciate the last team of delegates for their introductions. Can we do yeah? Yeah, isn't it? 1, 2, 3. Once more, 1, 2, 3. Now let's appreciate ourselves now for the introductions. Then we'll proceed and have a quick overview of what we are here to do. Then we'll invite the opening remarks. This is how you're going to appreciate yourself. So we are here from east, west, south, and north to co-create, right? Isn't it? So you're going to do like 1, 2, 3, east. So if you're from this side, you know yourself. Just say east, west, north, south. Then east, west, north, south. Then you do it. Is that okay? Is that okay? Appreciating everyone for being here, because we are here to co-create. This is the basis. We start from here as we move forward, isn't it? So we are appreciating you for being here. So warm it up. So we go. 1, 2, 3. 1, 2, 3. Can even do it. So let's do it now. Let's do it now. It's important to just, let's do it now. 1, 2, 3, let's start. Thank you so much. I'm not going to go through all the objectives because of time. We have it in our tables, but it's important for us to note that you're here by virtue of your individual expertise and institutional capacity in regards to issues of adolescents and young people. And you're here to work together, to synergize, to be able to come up with a workable plan that we can follow to be able to address the issues of adolescents and young people from the larger ESSA region. It's important to note that we'll be having opportunities to have dialogue. It's more of a dialogue engagement where we'll have the judiciary, members of parliament, the young people, able to bring in the experiences in the table, mix it up, and be able to come up with something that will be able to move us forward. We all know that regionally we have different policies, but we also want to come up with ways to identify some of the synergies that exist and be able to develop something that can cut across our countries to be able to be measured. At least at the end of 1 year, by the time we are coming back to have a similar engagement, we should be able to say, this is where we started from, and this is where we go. This is where we've reached. It's also good to know that we may have different backgrounds, but our story is the same. Our story is the same. Different background, different circumstances, but our stories are the same. That is why being here today, you being here, is a great opportunity for us to co-create and come up with something that then brings us together very and address the issues that affect the young people. I want to take this opportunity to just remind us again, I know we've introduced ourselves, that we want to take the opportunity to appreciate SADC PF representative, Dr. Moses Mugaza. Let's say, just wave. Thank you. We also have our Heavens Regional Director, Mr. Joy Mambege. We also have honorable members of parliament. We have 2. We appreciate you. Can we see you by a show of hands, please? There are 3. Then we also have the directors representing the ministries of health from our respective countries. Kenya, MOH, Malawi, thank you so much. Zambia, Kudzai is sitting in, she's doing this. Zimbabwe, Zimbabwe, thank you so much. Zambia, we have Namibia, we have Daktari. Also, take this opportunity to also acknowledge the presence of our civil society organization present from our larger ESA region. If you're from civil society, just raise your hand, just wave civil society. Most of us are, yes. And then, of course, we have our adolescents and young people. If you feel you're an adolescent or a senior, what did you say? Okay. Young people, adolescents, senior adolescents, let me see, by show of hands. That is supposed to be all of us, right? Feel welcome. So all delegates and all of us who are here, welcome. And I want to then take this opportunity to invite on stage opening remarks from Mr. Joy Mabenge. I was Southern Africa Regional Director. Welcome. Let's appreciate him as he comes over to the stage. You want this?
Thank you. Good morning. So you know this greeting thing, 2 years ago, I was in Tanzania, in Arusha specifically, at a training center called TCDC. So I had been there for so many times. And unfortunately, I'd never bothered to pay attention to language. So me and my colleague would come across people who are from that center. And then they would say, Karibu, Karibu. So my friend thought that Karibu was a greeting. So we thought, why can't we gel in? So we also meet locals. We say, Karibu. So we did that a couple of times until we were corrected. Do you know what Karibu means? Welcome. So you come from Malawi, you come into this space, and then you start greeting us as Zimbabweans. You say, welcome, Mauya. So that is a preserve for who? For us to welcome you. So this is something that happened, and I realized that no, sometimes you've got to at least appreciate the language. So I did appreciate this morning, and I'll greet you, Jambo. Jambo. That table where Kudzai is seated, you cannot just look at me as I greet you. Jambo. Jambo.
Very sad.
So we also say Apo, meaning all protocols observed. So that saves time because the facilitator has observed protocol, and that saves probably about 3-4 minutes of the 5 minutes allocated to me. Distinguished guests, government officials from Zimbabwe, Zambia, Uganda, Kenya, and Malawi, our esteemed partners, dedicated advocates, and most importantly, the dynamic young leaders in the room. I have the pleasure of welcoming you to this august gathering. As already said, my name is Joy Mabenge, and I have the privilege of leading the work of HIVOS in Southern Africa as the regional director, only 3 months into this position, and glad that my colleague who leads this portfolio, Limpo Chinika, seated there, and works with Kudzai and team, have done the fantastic work of putting this together. But I also must acknowledge the fact that it's not just ourselves as HIVOS who have put this together. we would not successfully convene this without joining hands with Restless Development Zimbabwe, with YAS, with CSA, and with the SADC PF. I thought I would single those out and mention that it is a joint effort. But of course, as you see us here, it's also important for me to mention to you that we appreciate the financial support from the Swedes, particularly SIDA. There is another big donor behind SIDA, but at this particular juncture, it suffices for us to mention SIDA. So we appreciate that support that allows us to execute this work. It is my singular honor, ladies and gentlemen, and pleasure, of course, to extend a warm welcome to you to this regional engagement meeting here in the Sunshine City of Harare. If you came in yesterday, it rained. It is the first set of rains for the season. So we are quite expectant and anticipating that the heavens will bless us with sufficient rains this season. We truly hope that it is going to be like that. We gather here in the spirit of a shared mission to dismantle the barriers that prevent adolescents and young people in East and Southern Africa from claiming their fundamental sexual, reproductive health and rights. Colleagues, esteemed delegates, we are gathered today united by a shared mission to dismantle the systemic barriers that continue to deny adolescents and young people across East and Southern Africa their fundamental sexual and reproductive health and rights. The challenges before us are undeniable. The age of consent laws, parental consent requirements, and pervasive stigma. These continue to restrict access to essential services, services that are critical to safeguarding the health, dignity, and futures of young people. The consequences: rising HIV infection rates, adolescent pregnancies, and disrupted education. These are not just statistics. And thus there is an urgent call to action. These realities threaten the progress we strive for under the SDGs and the promise of universal health coverage. At HIVOS, our mission is to contribute to just, inclusive, and life-sustaining societies where every individual, regardless of age or background, has equal access to rights, resources, and opportunities. This meeting, colleagues, is a direct response to that mission. It is a space for collective reflection, strategic alignment, and bold action to address the critical barriers impeding SRHR access for adolescents and young people in our regions. As part of our regional SRHR Fund campaign, Consent to Access, this convening has been intentionally designed as a process co-creation. The presence of young people from across the region is not symbolic. It is foundational. Your lived experiences and our most powerful evidence and your voices must shape the strategies and policies we develop. Over the next 2 days, our objective is both clear and ambitious, of course. To harmonize our efforts, we must move beyond fragmented national responses and build a coordinated regional front. Together, we will co-develop a unified regional action plan. grounded in shared commitments, robust accountability mechanisms, and a vibrant community of practice to ensure sustained impact. To our government representatives, we look forward to your leadership in translating these deliberations into actionable policy. To our civil society and youth networks, your advocacy continues to be the driving force of this movement. And to our development partners, your continued support is essential to scaling and sustaining our collective impact. Let us use this opportunity to listen deeply, engage meaningfully, and build consensus. Let us ensure that every adolescent and young person in East and Southern Africa can access the SRHR services they need freely, safely, and without discrimination. The journey towards equitable access begins with the commitments we make in this room. Let us make them bold. Let us make them count. I thank you.
Let's give a better round of applause to the director. Let us make them bold. Let us make them count. Can that sound like our mantra for this session? Let's make it bold and let's make it count. Thank you so much. Move very fast because of time and welcome remarks from youth advocates. And for this, I'm going to invite Ms. Tatenda Sangori. Please welcome on stage. Karibu.
I think I'm vertically challenged a bit. I'd asked colleagues from another country to give some remarks. So I'm not sure if technology is going to allow us to. Okay.
I am John Okello. I work for the Seventh-day Adventist Church, and I am happy that we are able to discuss issues regarding adolescence and reproductive health. And we are here to identify areas of where there are gaps so that we can address them. We need to make sure that we institutionalize and we standardize the content and the package we are putting, and more so, we want them to be inscribed in law so that whoever gets these services gets something which is standard and is institutionalized. We believe that the policymakers will address this and understand that that is a serious gap which we need to talk about and address so that these young people can be able to freely walk in and especially related health. Thank you so much. Be blessed.
My name is my name is both
in nature, every individual has an inherent right to health, including sexual reproductive health services. And so we are glad that even under our revised laws, for instance, the Children's Code Act, we have enshrined in there the need for sexual reproductive health.
So my name is Nathan Sinyango. I work for Ministry of Health. I'm based at Lusaka Provincial Health Office. And my role there is to coordinate HIV testing services. And so really with regard to the issue of consent, really we feel something that needs to be continually being addressed with all stakeholders and relevant authorities involved. Because really it's been a challenge on our part to provide quite a good number of services to adolescents and young people vis-a-vis HIV testing services. As we all know, for instance, like in the case of our country, Zambia, the age for consent still stands at 16. And what we notice that while other services are actually provided, we really see it very critical, especially when it comes to testing for HIV. Otherwise, for HIV, for as long as the child is below that legal age requirement, we wouldn't conduct an HIV test. And so it's something that we think really it has to be addressed because at 16, 15, even as early as 14, we see these adolescents and young people engaging in sexual activities as soon as they are sexually active. So now what we find it's so surprising is that for them to engage, they don't really need a consent from anyone. It's something that they wouldn't do, but as soon as they are sexually active, they just right there and then engage. So what we see at the end of it is sexually transmitted diseases, and really we see the number of HIV cases rising. So we really find it so fit that the issue of consent has to be addressed.
So today, the engagement was very fruitful, where all key players were able to give their inputs and even recommendation, and where there are policies or legal gaps that needs to be addressed. There are things that we can always raise with our leaders and even those in the legislative arm to look at the gaps that will be able to help improve some of the indicators affecting adolescent health. Above all, continuous engagement with stakeholders is key in terms of improving the health of adolescents in this country, not only in Kenya, but even around the region. Thank you very much, and may God bless you all. Thank you.
So I can just say thank you and go and sit, right? All right. So I've already been introduced. My name is Tatenda Songore. I'm the Executive Director for Youth Advocates. Today, we are not just gathered here as just an ordinary group, but we are coming together on quite a very sensitive topic within the Eastern Southern Africa region. If you are not moved by the fact that we are still the region that has got the highest burden of new HIV infections, and these new HIV infections are amongst adolescents. And if you are not shocked by the fact that the teenage pregnancies that we're experiencing within the region are on the rise in other countries. I was just looking at the statistics within the different countries where we are focusing. With our project, we're focused on Uganda, Kenya, in East Africa. In Southern Africa, we're in Malawi, Zambia, Zimbabwe. Within those 5 countries, we have noted that teenage pregnancies are not in the margins of single digits, than the double digits region, in which other countries with as high as around 32%. And when we talk about teenage pregnancies, we are experiencing pregnancy as early as 9 years. So imagine if a 9-year-old is experiencing pregnancy, and if an emergence happens, if they, for example, they are abused or defiled, depending on the law in different countries, and they are 9 years, and they just walk into a health facility. For a service provider, the first question that they ask is, what is this child doing? Where is the parent? Where is the guardian? That's the first thing. They do not ask the question, what is the emergency with this child? Why are they walking to the health facility unattended? That's the dilemma that we are in, that as far as we talk about access to reproductive health services, we are faced with a challenge where when we want to offer service, we ask the question, who is accompanying this child? Yet we should be asking the question, what kind of a service does this child need? Because across the world, the global frameworks, the regional frameworks, the commitments by government, they've committed to make health coverage universal. And we have known, according to the human rights context, that healthcare is a human right for everyone. We don't talk about age. But when we look within the region where we are operating, you notice that the laws are inconsistent. Oftentimes, you notice that the health service provision laws are always a bit progressive, but the child protection laws are always restrictive. And they restrict even healthcare services. And when you go to the policies, you have a brilliant strategy that is guided by the global, national, or regional clinical standards under WHO that says that we have to offer age-appropriate services, adequate services, affordable service for young people. And these laws are not backed, these policies or guidelines or standards are not backed by the law. And the child protection laws are always restrictive in nature in most countries. Now, this dilemma that we are facing is also coming in to zoom in when we go to the traditional tribes, traditional areas, the most remote areas, where we are experiencing high number of cases of child marriages or abuse cases. You will notice that in most settings, traditionally, under the customary, or whether it's within the law, it's not within the law. In Zimbabwe, we've got what we call apostolic sex. A 13-year-old can be married and no one will be arrested. And oftentimes, these are forced marriages. And when you want to investigate why are these perpetrators not arrested, you always find out there are always loopholes within the laws that do not protect minors when they're abused, minors when they are forced into marriages. And then coming into the laws again, these adolescents are not able to walk into a health facility without a third party or a parent. Now the question is, are laws supposed to be restricting access or protecting the right of children, of adolescents, of minors? This is why we are here. We want to discuss because we are all Africans. We are coming into the room, coming from different contexts, and we are discussing different issues. The advocate in me is always saying, we shouldn't be talking about the issue of restricted access, but we should be talking about protecting. And when I'm talking about protecting, we are protecting by delivering the service, no questions asked. But the stigma that we see at local health facilities, we see in our families, is very high. Even in here, if I am to ask anything related to sexual activity, you will not be comfortable answering the question. And now our 14-year-olds, when they're sexually active, our 13-year-olds, when they're sexually active, we're not saying it's right or wrong, but I'm just saying they're sexually active. Would they go and say, Mommy, I experienced it for the first time yesterday. What should I do? Huh? How many will be ready to answer that question? The African in me will belt out that young person. But here, when talk about access to services, the reason why we're here, we want to speak to the African in us. How can we ensure we are able to offer services and healthcare services, in particular sexual and reproductive health services, without stigmatizing young people, but ensuring that they get the quality, affordable care that is available to them? Well, the struggle is real. We hope out of these 2 days, we'll be able to come up with some key resolutions, key recommendations. Let's agree to disagree if we need to, but what we need to do is to come up with the right solutions for young people so that across these 5 countries where we are able to give quality recommendations for our governments to be able to be responsive to the needs of young people. Ladies and gentlemen, this meeting is for us to make and build the momentum and to ensure access to care. And I want to thank you, everyone who's here. And on behalf of the young people in Zimbabwe, we hope you'll be able to enjoy your stay. We are only about 1 kilometer away from Mukuwis Woodlands, which is a resort with a lot of animals. Please go and experience the nightlife of Harare. If you don't know where to go, we've got party lovers in the house who will be able to accompany you. Of course, I'm not sure about the Chief Executive Officer of ZNFPC, but maybe since you're a senior government official, please be the chief party convener during this meeting. So if you need to know where to party, maybe you can see me or the Chief Executive Officer. He'll introduce himself later. But otherwise, let's enjoy and let's be productive and let's come up with quality recommendations that you can action. Thank you very much.
Thank you. Thank you very much. Thank you very much, Mr. Tatenda. Can I see by show of hands the party lovers? Can I see by show of hands? Yeah, there are quite a number, sir. There are quite a number. Will be coming during tea break. Be ready for us. Yes, so make it bold, make it count, right? And Mr. Tatenda has made us understand that whenever we see young people in the facility, the question he asks is, who is this young person with? The question we should be asking, what service is the young person in for? Those are 2. We are collecting them, and they'll form part of our resolutions when we leave this place. So allow me to, thank you, sir. Allow me to then take this opportunity and join me in welcoming Mr. Leslie Garura from Restless Development Zimbabwe. Let's join hands as we welcome him on stage. Thank you, sir.
Morning once again. As mentioned, my name is Leslie Garura. Is that okay?
IT, you need to assist me here.
Is that okay? Can you hear me? Okay. This normally happens to me. They normally call me BBC, meaning born before computer or born before IT. Whenever I go on stage, things just happen. But anyway, that means you are now focusing on me. So I learned a new word today, APO, O protocol observed. Thank you for that, Joy. But you know, we acknowledge you all. As Restless Development Zimbabwe, I warmly welcome you to this important regional engagement meeting, a space where we come together in solidarity to advance adolescent health, rights, and well-being across the East and Southern region. It's a real honor to see a cross-section and representation of partners to committing to one shared goal and ensuring that every adolescent in our region can access information, services, and the opportunities that they need to thrive. I'm always reminded of a story within our sector, where we normally sit in these boardrooms with our air conditioners and our juices, and we map and plan solutions, right? But it so happened that in one community, people sat down and they noticed that women were walking, say, 10 kilometers to go and fetch water, right? So they sat down and agreed, no, we need to put a water source close to where the women are. So they came, they drilled a prolific borehole, water was available. But when they went back to the community a week later, the women were still walking 10 kilometers to go to that water source. So they had to sit down and ask, why? Why is it that we've done something nice for you, but you still walk 10 kilometers away? And the women simply said, the reason why we walk that distance is that that is the only time that we have to ourselves as women. That is the time we have to talk about our families, our husbands, in our own space. So when you put the bowl in the middle of the town, you are taking away that time for us. So what am I saying? I'm saying we are talking about adolescents. And I'm happy because the adolescents are here. We've got a cross-section of professionals from across the board, from government, from CSOs, from parliament, from all across the board. But I'm also happy because we are seeing the young people there. We are not shaping solutions for the young people in their absence. We are not drilling the ball which they don't want. So I would really want to
Thank you so much, Mr. Vedura. Thank you so much. We are connecting these goals. Make goal, make it, make it happen. We should not ask who the child is, but we should ask what side the child is coming from. We need to consider there's nothing for us without us. And so that makes it our organization. And lastly, because we are here, we have to reconnect, recommit, step up collaboration, and ensure there is meaningful inclusion of all parties. Thank you so much, Mr. Perula. I want to take this opportunity to welcome Mr. Faith Marie from Ghana. Once I asked about the evolutionary greetings, Faith is leading us in 19 months from Uganda. Let's welcome Ms. Faith Maria from Ghana for our celebration. Okay.
We will not be silent when our peers are denied care, dignity, and choice. We will work with you, government, partners, and allies, but we will also hold you accountable. Because the future we're fighting for is one where every young person can say with confidence, I was seen, I was heard, I was served. So I ask you, from the depth of your humanity, if not us, then who? If not now, then when? The urgency of our generation cannot be postponed. The future of Africa cannot wait. Let this engagement be
very young, and I'm still very young, but your words, your guidance, they still echo in my ears. Thank you for mentoring me. We have Madam Gertrude Ngwe from Ministry of Health. She took me at the same age when I knew almost nothing in terms of health. And we walked together the journey until where I am now. I want to appreciate you, Mama. Thank you so much. Then let me also we from the youth committee was so supportive, and she's so constructive. When I saw you coming in, I then said, oh, the business has started. I appreciate you, Honorable. For the interest of time, ladies and gentlemen, allow me to acknowledge all honorable parliamentarians here present. I want to acknowledge all distinguished government representatives here present. I also want to appreciate the presence of representatives from East and Southern Africa, and also our esteemed development partners and civil society organizations here present. Let me also acknowledge young advocates, young people, and champions of transformation. And I also want to let you know that I'm also doing the mentorship to others. So I've got also my mentees here. Tatenda, you can't run away from that. I also want to appreciate the media team capturing and amplifying our voices today. Distinguished delegates, ladies and gentlemen, thank you for being part of this important conversation. A refreshing morning to you all. Good morning, everyone. Good morning. I thought since it's a youthful engagement, it was going to be a bit noisy, though I'm now a senior youth. It is both a privilege and a profound honor to address this esteemed gathering at the second edition of the Regional Engagement Meeting under the Step Up for Adolescent Sexual Reproductive Health Access Campaign here at Cresta in Harare and in Zimbabwe, to be specific. I extend my warm greetings from Zimbabwe, and I would like to commend the organizers for convening this timely and strategic dialogue that unites government leaders, policy makers, decision makers, development partners, civil society organizations, and most importantly, young people themselves, young people ourselves, who are, and I consider you to be the heartbeat of our region's future. This convening is a joint effort by youth advocates, Restless Development, and Center for the Study of Adolescents with technical and financial support from CIDA through the YIVOS Regional SRHR Fund. From the program itself, you will agree with me that the meeting is dedicated to advancing adolescent sexual reproductive health in East and Southern Africa. Today, we are gathered here with a shared vision that every young person, every person, including persons with a disability in East and Southern Africa, deserves the right to access and utilize quality, integrated, youth-friendly sexual reproductive health information and services without fear, without stigma, and without restriction. Yet we know that this right remains unrealized far too many for men, adolescents across our region, which is a challenge. As I proceed with my keynote address, let me also remind you that before coming to the podium, Tatenda gave me a token of appreciation, not for me, but it's a figure digit token of appreciation, which he said during your remarks, if anyone manages to pick a word which you are going to repeat 3 times or more in your speech, you have got the honor to hand over that token of appreciation to that person. So after my speech, if you manage to pick a word which I'm going to repeat more than 3 times, you might be the lucky one to receive that 3-figure digit token of appreciation. The theme of this meeting resonates deeply with our shared aspirations for a healthier and more inclusive future. Adolescents, including persons with a disability in East and Southern Africa, represent not only a demographic dividend, but they also represent a generation whose health, wealth, rights, and urgency must be protected and promoted. Their access to comprehensive, youth-friendly sexual reproductive health service is not a luxury, but it is a necessity. It is a right, their right, and a cornerstone of sustainable development, which we should respect and consider. Across East and Southern Africa, young people continue to face significant barriers, which include, among others, which we heard from the previous speakers, legal, cultural, and systemic, that deny them their basic right to health, age of consent laws, parental consent requirements, and persistent stigma within health facilities. They continue to silence young voices and limit their autonomy to make reproductive health decisions on their own, for their own self. However, the consequences are visible and very devastating. We talk of alarming increase in terms of STI instances, including HIV, high rate of teenage pregnancy. Talk of Zimbabwe, we are now at 23%. Of course, we are celebrating the percentage down from 24%, but it's still very high. Child marriages is still very high across the regions. Preventable maternal deaths, we talk of 212 in Zimbabwe, but it's still very high. No woman should die whilst giving birth. It's preventable. Drug and substance abuse, mental health issues, unsafe abortions, as well as cycles of poverty that hold back not just individuals, but the entire community as well. Despite progress and national commitment, ladies and gentlemen, implementation often lags behind. Policies may exist on paper, but too many young people still find themselves excluded from the very services designed to protect their well-being. This regional platform therefore comes at a critical time to transform commitments into coordinated regional action, offering a unique opportunity to share innovations, harmonize strategies, and amplify youth voices. Let us learn from each other, whether be it a best practice from Zambia, from Malawi, Uganda, Kenya, or even Zimbabwe. Let us also challenge ourselves to go beyond the rhetoric and commit to measurable actions. I hear there is Machinga district in Malawi, is it? Those from Malawi. There's a Machinga district, is it? So you're privileged to have your chief on the podium. I have to make sure that I go back home, is it? I didn't know I'm from a royal family. I therefore urge us to prioritize adolescent sexual reproductive health in our national budgets and regional frameworks as number one challenge I want to pose on you guys. To strengthen data systems to track progress and inform decisions and policies. We also want to invest in capacity building for health workers and educators, and also to ensure meaningful youth engagement, involvement, and participation in program design and evaluation. We always say nothing for us without us. In this regard, the Step Up for Adolescent Sexual Reproductive Health Access campaign is a reminder on the need to strengthen the adoption and enforcement of laws and practices that are responsive to the realities of adolescents and young people. Over the next 2 days, we aim to review and compare age of access policies across our countries so as to identify gaps and opportunities to facilitate reforms. We also want to facilitate open dialogue among police and decision makers, civil society, youth networks, and service providers, because real solutions demand a multifaceted and holistic approach through strengthened partnership and collaboration. We also want to harmonize advocacy strategies to address age-related sexual reproductive health barriers at all levels, meaning to say national, regional, and international as well. We want to develop a regional action plan with clear commitments, accountability mechanisms, and pathways for sustained impact. And lastly, to strengthen partnerships across countries to ensure that progress in one nation becomes progress for the region. So, ladies and gentlemen, coming together as representatives across the East and Southern Africa is a clear demonstration of our collective commitment to regional solidarity and shared accountability. No single country can tackle these issues alone. The realities of our adolescents face are not confined by the borders. They go beyond the borders. Neither should our solutions be confined by the borders as well. We need to cross-pollinate for us to address this elephant in the room. We need to work together as a team. Our expected outcomes are ambitious, I know, but they are very achievable. Through a consolidated regional analysis, practical and supported action plan for sustainability, and renewed partnerships that turn discussions into tangible results, together we can move from isolated efforts to a united regional movement for equitable SRHR access and utilization. As we engage over the 2 days, let us remain guided by the principle that adolescents are not just beneficiaries of our programs, where we prescribe to them, but they are partners, they are innovators, and agents of transformation. We are the champions of transformation. We have to decide our future as young people. Their voices must guide our decisions and shape our strategies as well. When we invest in their health, rights, and leadership, we invest in the future of Africa itself. So let's then ensure that policies are translated into practice. Youth participation is institutionalized, not tokenistic, in policy formulation and program design. Youth systems are strengthened. Data-driven approaches are also implemented to guide our interventions and ensure that we leave no one and no place behind in our programming. As we deliberate today, as I conclude, ladies and gentlemen, let us remember that behind every statistic is a young person with dreams, is a young person with vulnerabilities, and is also a young person with potential, which we need to build as policymakers and decision makers. Let us be bold in our commitments, inclusive in our approaches, and relentless in our pursuit of health equity. We as leaders and adults, we must listen to the young people when they share their challenges, invest in our young people, and act accordingly, not judging the young people. We must create safe spaces, resource youth programs, and make sure policies and decisions reflect their realities. Together, we can build a region where every adolescent, regardless of their gender, geography, creed, or socioeconomic status, has the knowledge, support, and can easily access and utilize the services they need to thrive. I thank you all for your dedication to this cause. May this meeting ignite renewed momentum, foster enduring partnership, and catalyze transformative change for adolescent sexual and reproductive health across East and Southern Africa. Before I leave the podium to those who believe in the Bible, in the interest and respecting all our doctrines, I'm going to leave you with a verse from Philippians 4, verse 13. I can do all things through Christ who strengthens me. I believe in you. I believe in your power to shape a healthier and more inclusive region. Once again, I want to officially welcome you to Zimbabwe and express our commitment as government to action key recommendations from this engagement. Please enjoy the beauty and peaceful hospitality of our people, our culture, as well as our natural environment in Zimbabwe. Tatenda, siyabonga, sikomo, asante sana, I thank you.
Thank you so much. Thank you so much. What I'm picking is we need to move away from rhetoric to meaningful action. We have been talking a lot. Now we need to do something. That's what I'm summarizing from our engagement. So thank you so much for the speech. And as we've all noticed, it is only co-creation that then moves us forward from this. So from after tea, we need to start getting into it to ensure that we do what has brought us here and do justice to why we're here. I want to take this opportunity, ladies and gentlemen, it's past our tea time, but I want to take this opportunity to invite Vincent to give us a bit of the logistical note so that you are guided as you go for tea. And once Vincent is done, we'll also invite Tatenda to guide us on where we're going to take a group photo to commemorate our engagement here. So we'll do the logistic notes. Then after that, we'll be guided on where we are doing our group photo. And we'll also take a few minutes to grab a bite, then come back for sessions proper. Thank you so much. Can you clap for yourselves? Come on, clap for yourself. Thank you so much. Vincent, karibu.
Greetings once again. So my name is Vincent, as I had mentioned, and for logistical purposes, we've got international visitors. So we kindly request that you go and see Talent from Youth Advocates. She's outside. She's also wearing a yellow coat and a cap. I think she's seated just outside. And then we've got local participants as well. We've got, I think, reinvestments that have to be done later on. So at the end of the meeting, please may you kindly go and see Gamu from Yivos as well. She's outside. Thank you so much. All right, maybe I wasn't clear enough. Am I now clear? All right, I was saying for logistical purposes, we've got international visitors. May you please go and see, may you please kindly see talent from our youth advocates. She's outside, she's wearing a yellow coat and a cap. That's for logistical purposes for international visitors. And we've got local participants as well. I believe there are some reimbursements that have to be done. So after the meeting, may you also kindly go and see Gamu.
You in a yellow coat, you are the logistic person for international team?
Vivos.
You're
Hello.
doing logistics for the international visitors?
All right. For logistical purposes, for international visitors, we've got talent.
Mentioned you in a yellow coat.
She's outside. Maybe she can kindly come so that maybe people can see her.
You want us to bring in the lady in a yellow coat?
Exactly.
Okay. Come. They need to see you. I think it's good to know there might be a number of individuals with yellow coats, especially now that Zimbabwe will have colors, right?
So yes, that's talent for international visitors, logistical purposes. We can go and see talent. There she is.
Where will she be located?
She'll be just outside.
Okay.
And then for local participants, you may see Gamu from Evos at the end of the meeting. Maybe she'll come in later on as the meeting progresses so that you can also notice here as well. I think this is all from the logistics department. Thank you so much.
Thank you so much. Thank you so much. Again, allow me to then invite Kudzai or Kudzi and Nico to guide us. We need to do our photo, and we're going to do it in front of here in the podium. So it'll allow us to take a few minutes making the arrangements. But meanwhile, you can feel free to say hello to the person next to you once more.
I just need your mic. Morning, guys. Can we do a quick group photo? I would like all of us to come this side, then we'll face this side. So the young guys who can carry chairs, can you all just quickly right now pick your chair and come and just place it here for the senior adolescents who will sit in front. The rest of us will be standing on the stage. So can we quickly just get that done now? YAP, please, guys. Let's bring chairs, guys. Let's bring chairs. Just line them up here. Sure.
Another person, team.
Yeah,
another one
yeah,
up.
yeah. Yeah, you just leave room. That's perfect. And our senior adolescents, you may start to progress to the front and take your seats. I think that's fine. Another group will be standing here. Another group will be standing on the stage itself. I think the chairs are enough after that one, Tsitsi. Let's come through. Some on stage with me here, facing that way. The tallest at the back. Okay, are we settled? Are we settled? Are we looking at me? Are we facing me? Are we smiling? With that SRHR smile, you know, that energetic, full of fire, transforming Africa. Let's go. All right. If you can't see me, I can't see you. If you're hiding behind someone, try and shift to the front. The taller ones at the back. Okay, I think we're looking good. Huh? Oh, camera. Let me just try. Right. Everyone is in full frame. All right, in 3, 2, 1, smile. By smile, I mean I want to see your teeth. All right, hands in the air, those who can. Oh, where's the energy, guys? Huh? There's tea after this. I think it's good. Thank you so much.
Oh, it looks
Sure. Thank you so much. Yes, ladies and gentlemen, tea is served right outside the conference room. Tea is served right outside the conference room. We are doing our tea for 20 minutes. Hello. Tea is served right outside the conference hall, and we are doing 20 minutes.